Hi, I am Dr. Deepa Bhat. I am a genetic counselor at JSS Hospital, Mysore. I am also coordinator for the Mysore chapter of Rare Disease Care Coordination India under Organization for Rare Disease India ORDI. So let's know something about spinal muscular atrophy. What is this? It is a genetic neuromuscular disorder. So what happens in this? Since it is genetic, there is something problem in the gene. The gene is SMN. So if there is any problem in this SMN gene, then the protein synthesis is affected. So what will happen? The motor neurons that are present in the spinal cord starts dying. With this, the signals to the skeletal muscles get affected. As I already told, it's a genetic disorder. How will this happen? It is an autosomal recessive disorder. That means two copies of abnormal gene must be present to manifest the disease. This usually happens when the parents carry this gene and they are called as the carriers. This chance of having an affected child increases whenever there is a consanguineous marriage, that is marriage in the closest relatives. Symptoms depends on the type. Sometimes it can manifest in the early neonatal, that means just the baby is born, there will be hypotonia, difficulty in breathing, we call it as type 0. If it manifests little later around 6 months, type 1, then up to 18 months, type 2, and elderly, it is adults around 20 years, it is type 4. So severity depends on the type of the spinal muscular atrophy. So how shall we diagnose that the person has got a spinal muscular atrophy? Most of the time it is clinical manifestations. The pediatrician and the doctors, based on the symptoms they suspect, and they will be referred for genetic counseling. So in the genetic counseling that is done by a counselor, they offer a wide range of services. What are they? First, they will be given a pre-test counseling. So in the pre-test counseling, we explain them this could be a probable diagnosis. So let us get tested. What is the test? So we do a test for SMN gene specific. We call it as a MLPA, multiple ligand proband assay. By doing this, by looking at deletion and duplication of SMN1 gene, we will diagnose, and based on SMN2 gene copy number, we will assess the severity of this particular condition. So once they are diagnosed, that is, if there is a homozygous condition, then the child or a person is considered to have this spinal muscular atrophy. What is the problem? This disease currently is not curable, but luckily few of the medications are available now, like Risdiplam, Nusinersen, and nowadays gene therapy based Zolgensma is also available. But the burden of the disease is very high, maybe 1 in 1000. How many people can afford this? It's very, very costly, and also timely availability is very much important too, so that this particular treatment will be beneficial. Every day the neurons die and later the child gets the treatment, the outcome because of this particular treatment will go on declining. So if the affordability and these concerns are addressed, it would be good that the treatment options are available. However, the most common question asked by the parents is, what about my next pregnancy? What will be the status of my next child? Here is the answer by the genetic counselor. So, we already know that there is a mutation by testing the affected kid. Now, they will be offered with the preconception carrier testing to check whether parents are the carriers for this SMN mutation. Then during the pregnancy, they will be educated to undergo the prenatal diagnosis. So, what is prenatal diagnosis? So, in this, the baby inside will be tested whether it is affected or not. So, if it is done at 12th week, the procedure is chorionic villi sampling. If at the end of 16th or 17th week it is done, then it is the amniocentesis. The chorionic villi sample or amniotic fluid is taken, fetal DNA is separated and tested for the mutation. So, since it is autosomal recessive, as I said, there is 1 in 4 chances of baby being affected. That means it is 25% is a risk. But keep in mind, it is, people always think that if one child is affected, next 3 kids or pregnancies may be normal. No, it is chance in every pregnancy that 25% will be affected. So, testing every conception is essential to understand the status of the fetus. So, once the results of these tests are available, suppose the child is affected, the fetus is affected, then we explain the parents that what is the future. That means your child will again be having manifestation like your previous kid. So, they can take an informed decision whether they can continue the pregnancy or terminate. It is exclusively the decision of the couple and the family. So, genetic counselor would give a description about what is life living with the affected child. That is on one side. Since this particular mutation is highly prevalent in general population, it is many times offered as a carrier testing. So, if a lady is a carrier, then definitely test the husband. If both are carriers, then offer the prenatal diagnosis. So, this is about prevention. We always know that prevention is better than cure. So, what we do? We test the child, check the status of the disease. If affected, option for termination is given as per the PCPNDT Act. Now, I already have an affected child. What to do? So, a genetic counselor will also refer you to a suitable pediatric neurologist and help you in getting a comprehensive care with physiotherapist and suitable patient advocacy groups. So, this will help to collectively assist in treatment and also rehabilitation of the affected child. We also help you to give the moral support, emotional assistance and also living and coping with the disease and also the process involved in entire management of that affected kid. But however, according to me, when we know that there is a carrier status and we also know that there is very easy cost effective methods are available through genetic counseling, I would prefer that you take this opportunity and prevent the birth of the affected child so that we reduce the incidence. So, as a genetic counselor, I would say that every parent should know their SMA carrier status, hence they can think during their pregnancy planning and also know the status of their child. So, thank you.